I'm joined now by Kathryn Jacobsen. She's a professor of epidemiology at the Department of Global and Community Health at George Mason University outside of Washington, D.C. Thanks for joining us. You know, we heard these huge numbers, 214 million new cases of malaria worldwide in 2015. But we're still seeing all these people dying as well. Where are we in the fight against malaria?
Well, we've made a lot of progress. The number of cases every year and the number of deaths every year is down by nearly half in some countries since just the year 2000. So we've had a lot of success, but obviously with nearly 440,000 people, mostly young children, dying every year, we still have a long way to go.
What's the problem? What's the cause here? Why are we seeing so many children dying?
Well, it is a function of mosquito bites and what we just saw about expanding access to bed nets. Certainly in a lot of places, especially in sub-Saharan Africa, getting bed nets out to kids is really helping to reduce the bites. But there is no vaccine, and so as long as there are mosquitoes, there will be people getting bit by mosquitoes.
How close are we to a vaccine? Because you hear malaria, at least in the Western world, and it seems like such this distant disease that maybe existed a long time ago, but here we are, we're hearing of all these deaths. But how close are they to a vaccine?
There's been good progress on some candidate vaccines, but they aren't ready to be rolled out just quite yet. So in the meanwhile, what we have to do is really focus on prevention of mosquito bites, and then also making sure that people who have malaria have access to diagnosis and then to appropriate treatment. So besides the nets, one of the things that's been really important is expanded access to what we call RDTs, rapid diagnostic tests. Where people get malaria, often there's a tendency to treat it as, well, I'm going to wait and see if it's something else. And you maybe wait 3 days or a week before seeking treatment, and then it might be a really advanced infection. With the RDTs, people can know right away if they have malaria, and they can start the treatment right away. And if it turns out it's not malaria based on the test, they can be treated for the thing that they really do have. And so that also means there's a greater chance of a good outcome and survival.
You know, we saw the mosquito nets, but is it really as simple as using mosquito nets and other preventative measures?
Often it is. We've seen that through what we call behavior change, which means being really good about using those mosquito nets, re-dipping them. It's not just that they're a barrier to bites, they also have chemicals on them that kill mosquitoes. And so it's protecting the whole household by having those nets present.
Zika also in the news. Where are we on Zika? A few weeks ago, we heard doctors come out and say that it is worse than they had previously thought. As we enter this summer mosquito season, are we going to see an uptick? Are we going to see it spread?
We probably will see more cases, especially in places that are in the Northern Hemisphere that are heading into summer. We are getting more evidence in that Zika does in fact cause microcephaly, and that's very concerning. I think a perhaps balancing perspective for that is that at first it looked like a very high percentage of women who contracted Zika while pregnant would have babies with birth defects. It looks like that rate of microcephaly is probably more like 1 in 100 pregnant women who contract Zika during the first trimester. But obviously, any case of a preventable birth defect is a case too many. So we will be having aggressive mosquito control against Zika here in the United States and in other places in the Western Hemisphere.
Kathryn Jacobsen, thank you so much as always. We appreciate your perspective.